reporting on our end as well. Okay, great. Hearing nothing, we will get started with Dr. Sarah Kemble, state epidemiologist, and Joe Elm, one of our epi specialists, to give an update on monkeypox in Hawaii. Dr. Kemble.
Thank you, Katie. We are here to share with you today that DOH has identified one probable case of monkeypox in Hawaii. The individual is an Oahu resident and is currently hospitalized in stable condition. The individual presented with symptoms consistent with monkeypox and recently traveled to an area with confirmed cases. The State Laboratories Division confirmed orthopox virus infection. Monkeypox is a type of orthopox virus. Samples will be sent to CDC next week for confirmatory testing. The individual is currently hospitalized, but as I said, in stable condition. So what we want everyone to know is that the risk to the general public remains low. Monkeypox does not spread easily from person to person. I'm going to hand off to our disease investigation supervisor, Joe Elm, to tell you a little bit more about monkeypox transmission. Joe, can you unmute yourself, please? Are you able to unmute?
Okay. Can you hear me now? Yes, you can hear. Oh, fine, great. So monkeypox spreads through close, prolonged contact with an infected person. And this means contact with body fluids or lesion material or items that may have been used by somebody that has monkeypox. While monkeypox can be spread through large respiratory droplets, the monkeypox virus generally does not travel more than a few feet, so prolonged face-to-face contact is usually required. It's a rare disease, and infection begins with flu-like symptoms, swollen lymph glands, and progresses to rash, sores, often on the hands and feet, chest, face, genitals. Individuals generally become ill within 21 days of exposure. If you have symptoms consistent with monkeypox, you should contact your healthcare provider and the Department of Health immediately. Nationally,
thanks, Joe. Nationally, I wanted to say that CDC has reported that many cases in the national outbreak have been among men who have sex with men, gay, bisexual, and other men who have sex with men. So it's important to note that monkeypox is not in and of itself a sexually transmitted infection, but it can be spread through close, prolonged contact. We're continuing to investigate the case and are monitoring close contact. We're working with the CDC as part of the national investigation into monkeypox infection, and we're coordinating with the federal authorities to make sure that we have access to vaccines and antiviral medications for those who are impacted. We're here to take questions.
And if reporters who have questions want to raise their hand. I see Jen.
Yes, thank you very much. Can you tell us where the person who has probable case, where did he travel to or from?
The case traveled outside of the state to a mainland US state where there were other known cases.
You can't share with us which state that was?
For the confidentiality of the case, we are not disclosing additional details, but there is information on the CDC's website about states that have reported cases. There are many across the United States now that have reported cases.
Thanks, Jen. And I see Jomani next.
Where is the patient hospitalized?
Again, our policy for confidentiality reasons is not to disclose specifics on the location of the case, other than to say it's in a Oahu resident.
And Jelani, if you don't have a follow-up, I see Ali.
Hi, yeah, can you hear me?
Mhm.
Okay, so just to clarify, the disease can spread through various types of bodily fluids then, not just saliva.
Joe, do you want to take this one?
I think Joe might have lost internet.
So the primary mode of spread is going to be from lesions, especially when a lesion is unroofed. That can expose infectious particles of the virus. Saliva can also be a mode of transmission. To my knowledge, semen and other bodily fluids, I don't know what the risk of transmission for those fluids are, but primarily it's going to be direct skin to skin contact or potentially close prolonged contact because of that potential for droplet spread from saliva.
Okay, great, thank you. And Jen, do you have a follow-up?
Yes, you say skin to skin contact. The CDC also lists or says that you could also get it from if you use items used by the infected person. So give me some examples of that. What does that mean exactly?
So that would be a rare mode of transmission, but for instance, there have been in prior international cases reports of suspected transmission from linens where a patient had stayed in the hospital bed for a while with many lesions, and then shaking those linens, potentially sending virus particles into the air and infecting the healthcare worker. So there is a theoretical risk from direct contact with objects that the lesions from the patient have been directly in contact with, but that is a rare mode of transmission. Primarily, it's going to be prolonged, close face-to-face contact with an infected person.
So potentially if you borrow someone's sweater and they have the lesions, or if you lay in the same bed as someone who has the lesions, is that possible?
What we're recommending to those who have a rash illness that's suspected for monkeypox is to isolate at home to the extent that they're able, to avoid close contact with other people so that we can minimize that kind of risk. But again, this would be a very unusual circumstance to pick it up from home. It is possible, but it's not the main thing that we're seeing.
And Jelani?
If this case is confirmed, would this be the first monkeypox case in Hawaii?
In this outbreak, this would be the first case if we confirm this case.
And then the other question that I had is, I know you're saying that the risk is low, but obviously summer is a busy travel season. Anything you want to say to the public? We're also trying to be safe and be cautious because COVID is obviously on the rise again.
Right. I think for this particular outbreak, the emerging risk factors are fairly, clear-cut risk factors, as in we're definitely seeing a risk to our gay, bisexual, and men who have sex with men communities. So I think one word of caution there is to be aware of that there is an ongoing outbreak, how the disease is transmitted through close prolonged contact, and to be aware of any symptoms develop to let your healthcare provider know right away. And if you develop rash lesions with this characteristic rash illness, there's some pictures now available on the CDC website for the reference. That's something to let your healthcare provider know right away.
So the US is obviously a non-endemic country to monkeypox, and there's concerns that we may have little immunity to it. Do you have anything to add to that?
Monkeypox is a very rare disease and typically isn't one that circulates through human to human transmission as an endemic disease. There is endemic disease in animal populations in certain parts of the world, but not in the United States. So I would just say, again, this is still an outbreak which is related to certain higher risk groups. It has been associated geographically with travel, but I think the key point is we're seeing lots of travel, so people can always be moving. And during the summer travel season, to focus on some of those risk factors of close prolonged contact and higher risk settings, that's something that you should be aware of.
And I see Cassie's hand up.
Hi, sorry, I'm just having a hard time hearing you, Sarah. Did I hear right that you sent the test results to CDC, so you're waiting for them to confirm if it's a positive case of monkeypox?
We're expecting to get confirmation next week.
Okay, and then one question is, how concerned is the health department about monkeypox in general, and if there's any consideration about having people get a vaccine?
Right now, any treatment or prevention measures, medical measures to treat or prevent monkeypox have to be coordinated through the Centers for Disease Control and Prevention. These are not medications for prophylaxis. Sometimes certain vaccines are used. These are not medications and vaccines that are readily available in the general medical community. So we are working closely with the Centers of Disease Control and Prevention to determine when and if treatment or prophylaxis is indicated, and to work with those at-risk individuals. That's again why it's so important for both if any individuals develop a rash that they are concerned about monkeypox, to talk to a provider, and for providers to call the health department right away if they suspect a case.
Thank you, Dr. Kemble. And next we'll go to Tim.
Hi, can you say when the victim went to the mainland?
Travel for this case occurred in the month of May.
Within this month?
Within the month of May.
Within the month? Okay. And when you say prolonged contact, can you be more specific at all?
So if it's direct contact with a lesion, then the time period may be shorter in which transmission could occur, especially if the person who's in contact with the infected person has open cuts or wounds on their skin as well. When we're talking about the prodromal phase, when someone doesn't have a rash yet, but maybe they have fever, body aches, that's a phase which can also be infectious, and we think the infection during that phase occurs through the respiratory droplets. And so that would be standing face to face with someone in close conversation or interaction for several hours. But it's not easily spread like respiratory diseases. This isn't like flu or like COVID. It is much harder to get monkeypox.
Thank you.
And back to Ali.
So do masks prevent, the spread of monkeypox? Is that sort of a necessary thing as a measure to, prevent the spread of the disease?
Wearing a mask does help prevent transmission through saliva droplets. So for healthcare workers, that is one of the recommendations when seeing a patient with suspected monkeypox illness, to wear a mask to prevent transmission.
Thank you. And we'll go back to Jen.
How long generally does the illness itself last, and how long does it usually take until the lesions appear?
So are you back on?
Yes, I'm back on. Can you hear me? Your question was, how long do the lesions last?
How long does the entire illness usually start? So, if you first start with a fever or, the fatigue or whatnot, and then how long till you get the lesions? Yeah.
It's going to be very individual, how long it actually lasts. Normally, 1 or 2 weeks after the first lesion appears, the rest of the lesions will be crusted over and the person will be non-infectious anymore. But some people will resolve in 7 days, some will resolve in 14. It's always a window that, it depends upon the health of the individual. There was a second part to that question.
Just usually how long does it take until the lesions appear from the time you're infected?
Well, anytime between the 1 and 21 days that we're following as the incubation period. Normally, it's going to take about a week for the prodrome to appear, which is going to be first fevers and body aches and so forth. Then once the rash appears and the oral lesions marks the time when the person's going to be most infectious. So this may be 3 to 5 days of this prodrome of body aches and fever, chills, and so forth. And then once the rash appears or the oral lesions, then that's going to be the start of the most infectious period of the person. And that's going to last, 7 to 14 days.
One thing I'll mention though is that in the current national outbreak, we're told that there are a number of cases that are presenting typically with less of the prodromal symptoms, or sometimes not even with prodromal symptoms. And we're also seeing more cases that have rash in the genital area, which may relate to some of the close contact that's going on. So there may be some differences specific to this outbreak to be aware of.
Thank you. And next we have Jolani.
How many states have confirmed monkeypox cases?
I think that's 11. Is that correct? This morning I thought I said 11 US states had confirmed monkeypox.
And I know you folks won't identify the state, but the state that the person traveled to, is it a popular destination for the summer or in the summer to travel to?
Yeah, again, we're not going to talk specifically about locations out of respect for the confidentiality of this case. But again, you can refer to the CDC website for states that have reported cases.
Thank you. And we'll go back to Cassie.
I think this is my last question, but do you know what day next week that you guys will actually get confirmation if this is going to be the first monkeypox case in Hawaii?
I do not know as of today. We're working on shipping arrangements and coordination with the CDC right now.
Great. And any further questions? Okay, if not, thank you so much to Dr. Kemble and Joe for joining us, and all of you for joining us from the media. We will make sure to keep you posted when we have more updates. Thank you.